Colorado is a state of cool, dry air and high altitude, making it an ideal place for many tuberculosis patients in the 18 and 1900s. I, Joanna Freeman, experienced the harsh outbreak of this disease, which I believed it was my responsibility to nurse the many patients suffering from this disease. I started out by volunteering at Beth Hospital, which was built on land donated by General William Jackson Palmer. By 1917, the hospital had 85 beds and charged tuberculosis patients about $10 to $30 per week for room and board. I also did my share volunteering for Union Printers Home, built in 1892, was to serve elderly and sick members. The home opened in 1892 with 63 rooms and was referred to as a home for the aged and sanatorium for the tuberculars of the International Typographers Union. The biggest place I volunteered for, holding up to 12,000 patients, was the Woodman Sanatorium. This was my longest volunteer time I had ever done. One sanitarium that stuck out to me was the Glockner Tuberculosis Sanatorium, opened in 1890, created by Mary Gwynn Glockner in honor of her husband Albert, who had died of the disease. Throughout my years, I had helped many patients. Colorado streets were flooded with what we called lungers. Half the population of Colorado were sick people with this disease or seekers of gold. Even though tuberculosis is a fearful disease, it made big financial changes in Colorado. Architecturally, tuberculosis helped create a local cityscape and made big money because of all the sick patients yearning for treatment. Tuberculosis was a good and bad part of Colorado. It gave Colorado cityscape and money. However, the streets were flooded with sick people coughing into sputum cups. This made the disease shareable and was affecting many people. Luckily, I was one who did not catch it. Hundreds of huts were developed in Colorado during the tuberculosis outbreak. These huts were for patients with this disease to stay in and become healthier. I decided to go and check on these patients every once in a while. Sometimes, they were almost as a little civilization, or some were roughly scattered around. When the disease of tuberculosis started to die down, many of these sanitariums and huts were changed. Many sanitariums were transformed into local hospitals, and most of the huts were taken down. However, some stayed remaining. I figured out that there was about 17 sanitariums in the Pikes Peak region. I did my share at a handful of these. When the disease started to die and the sanitariums were turned into hospitals, I worked as a nurse, still helping people with sickness. Because of the fortune Colorado got from this disease, many people were surprised when tuberculosis started to die down. However, many were happy to see less people getting affected from this disease, especially the ones who saw their loved ones die from it. Tuberculosis brought good and bad things to Colorado. However, it is a piece of history making Colorado unique. I was given great opportunities to help many people, and Colorado making it easier to do so.